ahead of Veterans Day, there's new hope for local veterans battling PTSD and depression. One Santa Monica doctor is treating veterans with an infusion of ketamine, and he says the treatment is having radical results. Joining me to talk about this is Dr. Rand McLean. You administer this to your patients. Let's start from the beginning. What is it and how does it work?
Well, ketamine was originally used as an anesthetic. It still is, and it's used mainly in ERs or with children because it's so safe.
Right, so it's safe in terms of using it as an anesthetic, but how does that work in terms of being able to treat PTSD or depression, things like that?
Good question, because of the way it works as an anesthetic. It's what we call a dissociative anesthetic, so someone can still be aware of their surroundings to a large degree, unlike just being corked out. For that reason alone, it's a lot more safe. But originally, again, it was used for children and for cases where it might be more risky.
So what does it do to your brain? I read somewhere something about it rewires your brain cells or the...
Well, we think we know what's going on. We still don't know what's going on with standard antidepressants, but the way it works, we believe, is there's an area of the brain called the NDMA, and it's where a lot of these traumatic events are consolidated from there into some place called the hippocampus, where we store our memories. But there's a neurotransmitter there called glutamate, and I know I'm giving you probably too much information, but the glutamate is blocked, in a sense, by the ketamine. So we think that's what stops that, and it breaks up that connection.
And so what have you observed in terms of how it helps veterans?
Well, I've seen some pretty amazing stories, and I'm not the only one. The problem with the standard treatment is it takes a long time sometimes. A doctor will give you an antidepressant, a selective serotonin reuptake inhibitor, and they'll say, now hang in there, you gotta wait for about 6 weeks. But with ketamine, we see results sometimes in an hour after the infusion. So, and there's reasons for that if you wanna get technical, we can go into, but one of the main things is not only the mechanism by which it works, which allows you to sort of step away, that disassociation I was talking about, and you can detach your emotions and look down upon yourself. A lot of the veterans or anyone who uses it describes it that way, and see your situation without all the emotional attachments and go, well, gee, all I have to really do is this, this, and this, and I'll be fine. But the speed with which it works is also very, very, well, it's very important for someone who not only has PTSD, but some of the comorbidities that include suicidal ideation. So
right, so just a little bit more about when you say when it works in an hour or a few hours, it works in what sense? You have somebody that comes to you in what way and what condition, and then they come away after maybe having a dose of that, and they're what? Well,
the easy one is with the suicidal thoughts, yes, but also just someone who just doesn't feel like they have much going for them, they can't do much with their lives, they don't feel like the most recent patient we were talking with just today, he's back to painting again. You know, so just feeling better right away rather than, okay, waiting for the drug to kick in and not feel as depressed.
All right, so all of that sounds good, but are there any side effects or any long-term concerns about it?
Well, that's one of the beauties too, is certainly in the short term, we don't see too many side effects. You don't want to treat someone with schizophrenia, that's one of the contraindications. And you don't want them on certain other drugs, so you need to screen for that too. They also have to be good candidates. Everyone has to be a good candidate for treatment. And by the way, it should always be done in conjunction with what we call CBT or cognitive behavioral therapy. But long-term use with a lot of ketamine, a heavier dose, we have issues with what we call the detrusor muscle of the bladder. But you can definitely avoid that if you're careful.
So this is more of a short-term treatment, and then people are able to kind of go on with their lives without it?
Some of them are. Again, if you use the cognitive behavioral therapy to, the ketamine blocks or erases what I call the rut that you've gotten into, okay? These men and women get into a situation where they might be the point man in a military excursion, and you want somebody who goes to what we call DEFCON 1 or fight or flight right away, and they're really good at it, but then they come back to the States and may not be such an appropriate reaction to, when grandma hits you with the
Right,
cart at the grocery
absolutely,
store.
right. That's one of the issues with veterans, is that just adjusting to the difference of civilian life. So just last question for you, how affordable is this for somebody who maybe doesn't have insurance, or has insurance through the VA, or has limited insurance?
For someone with insurance, it's not that bad.
What's not that bad?
Well,
What's the out-of-pocket cost?
Probably about $150
Per,
treatment.
which is how many treatments are you getting in a year or a month?
Well, I was going to answer your question earlier, but I got long-winded. But normally, again, it requires some consistent treatment. Hopefully, we can get you out of treatment, but we'll use 6 infusions usually in the beginning over 2 to 3 weeks, and then once every 3 to 4 weeks, normally people feel better with an infusion.
So it's expensive.
Right now it is, but we're trying to get the Veterans Administration to help out, see if they'll subsidize some of this, because it's so convincing, the results.
Yeah, all right. Well, thank you